I'll be doing a webinar in the next month on long COVID. Why? Because we need an update. We need a state-of-the-art update. One thing we can say is that in the American literature, medical literature, there's almost no information at all on how to treat long COVID. It's not up to date. We know that $1.7 billion was invested in long COVID research, but not a single publication has come from that research. And all they talk about is the definition of long COVID when COVID first came out. So long COVID was really coagulation issues, was thrombosis, was clotting, was lung disease. It's no longer the case. Now long COVID is a completely different animal, a completely different disorder, which is much more likely to be autoimmune in its essence. This is, again, years after the virus first came out in 2020 and the virus started to disappear in 2023. Well, we're almost 2 years out of that, and we still don't have a coherent discussion on how to treat long COVID because there isn't a coherent strategy revolving around the model. It is a model of post-infectious autoimmunity, and it has to be looked at in that particular way. And then we might have a handle on treating the majority of patients that have long COVID, some patients being more recalcitrant or more difficult than others. But we don't have to wait till someone is seriously ill to get rid of the fatigue, to get rid of the imbalance in the gut biome, to get rid of the neurological sequelae. Many functional medicine doctors are developing our own strategies to deal with autoimmunity as we have in the past. The autoimmune state that we have much experience with, and more experience than doctors at Johns Hopkins and Stanford, etc., because we also treat autoimmune disorders there, is Lyme disease patients. The functional medicine doctors treating Lyme disease are the ones more apt to be able to find potential therapies that would mitigate the symptoms of long COVID because they both share a post-infection autoimmune state. We need to have a completely different paradigm to think about it and to treat it.